Thank you for accessing the Northumbria Healthcare NHS Foundation Trust Living Well with Pain service. This presentation is designed to give you an overview of the Living Well with Pain service so you can make an informed decision whether you wish to engage with it. The pain service was recommissioned in 2019, resulting in some changes. Historically, the pain management service, as it was known, was led by doctors, consultants in pain management, with a team of psychologists, physiotherapists, and a nurse attached. The doctors focus primarily on treatments aimed at reducing or relieving pain, such as medication or injections. The focus has now shifted with evidence regarding the lack of long-term benefit and potential harm from these treatments. The focus of the new Living Well with Pain service is guiding and supporting you to live with your pain and improve quality of life. Interventions are aimed at turning down the volume of pain rather than pain relief or reduction. Within this brief presentation, we aim to explain what the Living Well with Pain service is, to provide an introduction on how persistent pain works, to explain what interventions we have available within the Living Well with Pain service, and discuss your options from today. These are the Living Well with Pain team members, including physiotherapists, nurse specialists, and psychologists. Please note we do not have any medical consultants in the Living Well with Pain service. As already mentioned, the focus is on quality of life. We aim to reduce the effects of pain and its effect on your quality of life and help you live with it. Note the words guide, help, support and educate. The Living Well with Pain service can provide you with information and guidance to develop new skills aimed at improving your self-management. It is centered around your current pain-related issues and your personal aims and goals. There may be something specific you want to get back to, such as walking or valued activities, but you're not sure where to start. Our team can offer guidance with this. Pain can be difficult to accept, and we can help you make the adjustments if you are ready to. It has to be noted there are certain things we cannot offer within the Living Well with Pain service. These unfortunately are a cure or fix to your pain symptoms. We also are unable to provide further investigations, and we do not offer changes or prescription of medication. The pain cycle. Here we have pain at the centre with many factors surrounding it. Over time you can become less active, not doing activities you used to enjoy. You may avoid activity in case it causes pain to worsen. Over time you lose fitness, leading to increased sensitivity. You may feel more fatigued and lethargic. The immune system changes and you can be more susceptible to viruses, or you may have prolonged recovery following illness. Sleep problems are very common, as are stress, fear, anger and frustration. Persistent pain also impacts on work and those around you and can cause you to avoid going out and feeling isolated. Anxiety and feeling low are also closely related to pain. Persistent pain can have a really detrimental effect on many aspects of your life and be difficult to manage, and many vicious circles can occur. Pain and damage. The original theory of pain from around 300 years ago was that pain was equal to tissue damage, and this was pre-scientific understanding. This was the medical model of pain until the last 30 to 40 years, when a better understanding was developed through science and research. The red line on the slide would indicate that pain equals tissue damage. However, we know that persistent pain does not follow that pattern. Pain can be better some days and worse others, and there is no change to damage. This is demonstrated by the blue wavy line, which varies in intensity and does not follow a set pattern. The X-ray shown here shows arthritis in the knee. Studies have looked at patients with the same level of arthritis on X-ray. If pain was equal to tissue damage, you would expect those patients all to have the same amount of pain. However, at one extreme, some had no pain at all, and at the other extreme, some patients could hardly walk. This shows there are more issues to consider than just tissue damage, and this is only one factor that influences pain. The nervous system can become wound up and sensitized, continuing to send pain signals even when there is no tissue damage present, or the cause of the pain has been removed, for example an amputated leg. You may have heard of people still feeling in their leg even though it is no longer there. How pain works. Acute pain, such as following an injury, infection or surgery, tends to follow a pattern, whereas persistent pain does not. Acute pain has nothing to do with how intense the pain is, it just means any pain that lasts less than 3 to 6 months. Persistent pain is that which lasts beyond this time, and one which cannot always be given a diagnosis. Sometimes symptoms are medically unexplained, and investigations such as scans and x-rays do not always help in diagnosing pain. They certainly do not measure the intensity of pain. 3/4 of people will improve after an acute episode, however 1 in 4 will have continued persistent pain. Pain is less to do with ongoing damage and more to do with an alteration in the function of the nervous system. Changes in the nervous system and the nerves themselves can continue to produce pain even though the tissues have healed. Pain cycle part 2. We revisit the pain cycle again here. We now know tissue damage is only one factor. The physical, psychological and social effects of pain feed into it and influence it. Lack of sleep can increase pain, and low mood releases chemicals into the bloodstream, activating nerves which carry pain signals. Social isolation can increase low mood and feed into pain also. If you become less fit, when you try to do activity, it hurts, so you tend to avoid it, becoming less fit and deconditioned and so on. Stress can cause a response which turns up the volume of pain. Social isolation can have a detrimental impact on mood and increase pain. The Living Well with Pain focuses on educating you to try and improve your pain experience and improve quality of life rather than pain reduction. These factors can be modified by Living Well with Pain interventions. If you decide you're in a position to learn to live with your pain and would like to opt into the service, your first contact would be with members of the team for an assessment. This focuses on how pain affects you and what your aims are. It is about approaching pain in perhaps a different way to what you've previously and thinking about what is of value to you. This may include increasing activity and getting back to things you enjoy. The assessments are held trust-wide in the mornings and afternoon where appointments are available. We will discuss what parts or part of the service may be suitable to guide and support you live with your pain. It requires commitment on your part to put the principles into practice and maintain long-term benefit. You will need to be in a position to take this approach forward and engage with our service. If you are awaiting investigations or surgery linked to your pain, it may not be the right time for you. If you are looking for pain relief or medication, our service is not the right place. Your GP is in charge of medication, and you may already have tried what's available. If you have persistent pain and want to develop skills to live with it, our service may be able to help you with this. The emphasis is on lifestyle change and the ability and commitment to develop skills in your own time, following our advice. Interventions available within the Living Well with Pain service. This slide is quite self-explanatory, and we'll give further detail on each of these throughout the presentation. Physiotherapy. Living Well with Pain physiotherapy uses a different approach to conventional physiotherapy. It focuses on your goals and what you'd like to get back to, using a cautious approach to activity and exercise. It does not provide hands-on treatment such as massage. It looks at where to start, offering guidance on how to progress at a pace suitable for you, and can help reduce fear associated with activity. Physiotherapists also provide pain education, and this can guide you with how pain works and what influences, improving the understanding of your condition. Psychology. Living Well with Pain psychology is pain-focused, with psychologists who specialize in the area. Our psychologists might, for example, work with you looking at meaningful activity based on your own personal values, or they can offer advice on mindfulness techniques and the focus of the impact of stress and anxiety on your pain. The emphasis is on reducing the impact of pain on your quality of life. Psychology requires commitment from you to practice skills in your own time and to attend a course of appointments, normally every 1 to 2 weeks. The Pain Management Program. Our Pain Management Program is a group-based course, 1 morning a week for approximately 6 weeks. This looks at the pain cycle in greater detail and teaches skills to self-manage and live with your pain. The emphasis is on personal goals and values, and the program teaches you to use these skills long-term to live with your pain. We also look at relaxation, mindfulness, managing pain-related negative thoughts, and sleep. There is a large commitment to this course and an expectation to work between sessions in your own time. The group is usually between 8 to 10 people and staffed by members of the Living Well with Pain team. Low intensity sessions. After your assessment within the Living Well with Pain team, there might be only 1 or 2 issues from the pain cycle that you're struggling with and do not require a full pain management program. These may be perhaps focusing on sleep or personal goals. If so, 1 or 2 individual appointments with our nurse specialist may be of benefit to allow you to focus on guidance with regards to these. After you have been referred to the Living Well with Pain service via your physiotherapist, consultant or general practitioner, there are 2 access routes into the service depending on whether you live in Northumberland or North Tyneside. In Northumberland, you have been referred via the JMAP service and will be required to ring 0344 811 8118 to opt into the service itself. If you live in North Tyneside, you will be contacted by a member of the Northumbria NHS Contact Centre who will offer you an appointment. At this point, if you did not wish to engage, you'll be taken off our current waiting list. Many thanks for listening to this presentation, and we look forward to seeing you soon.